Welcome to Nikki Videos. I am Judith at Chungwire, a midwife working with Mulago Specialized Women and Neonatal Hospital. I'm here to demonstrate the insertion of the orogastric tube. When we are going to insert an orogastric tube, it is important to put the mark from the mouth, move to the ear lobe, and between the symphysis sternum and the umbilicus in the middle, you put your dominant mark where the stomach is located. Now I measure. Place the feeding tube tip at the mouth to the ear lobe. Straight to the landmark between the symphysis sternum and the umbilicus. So we emphasize measuring because this is the estimated length that we can really depend on to get the length of the feeding tube that we want. So that's why these landmarks are very important. So we said you can mark using a marker or you can use a plaster. And we make a mark in case the tube moves out of position, you are able to tell that it has moved away and it will no longer be in the stomach. So gently hold our baby, support the head and the shoulder, and then you insert. It should be a smooth move of the tube. Always remember, when you find resistance, please don't force the tube in. Okay. So now we check and see if we are in the stomach. I have my syringe. I fold the oral tube and I open it. I fix the syringe and then I aspirate to see if I am in the stomach. So you can see the clear content, which means that I am in the stomach. I have to put back this content because it is clear. And I fold the tube, I remove the syringe, and then I close. I can also use a stethoscope . I'll put it over the stomach. I'll pull some little air in the syringe. Fold the feeding tube and then open. Fix the syringe and gently push in the air at once. It makes a gush of sound. Then I know I am in the stomach. So I will remove the syringe and close the feeding tube. And then I'll get my tape and fasten my orogastric tube. Let us look at how we feed the baby using the feeding tube. You need a syringe, and then the milk. You draw the amount of expressed breast milk that you want to feed your baby, and then I'll put it in a container. And with the same syringe, I will remove the piston. Then I come to my baby. I'll fold the feeding tube. We fold it because we don't want excess air to enter into the baby's stomach. And so I open it, I fix my syringe, and then I put my milk that I'm going to feed the baby with. So the baby should not be lying. You support the baby's head, or you can carry the baby in a feeding position. And so you release the orogastric tube to allow the milk flow by gravity. And so I'm feeding my baby. So after feeding, always remember to cover the feeding tube. So how do we test the feeding tolerance? Every time you come to feed the baby, one, you should look at the abdomen. It should be soft, and the baby should not be vomiting. The baby should be passing stool in a normal way. Important things to note when you are using the orogastric tube or nasogastric tube. Every time you're coming to feed, always check the mark that we put should be in the same place that you taped it. If it has adjusted and extended, then you may not be comfortable to feed this baby with the same tube. Please change and then replace. Always have the proper size of the feeding tube that you need. Remember to mark your landmarks as you start and insert your NG tube or orogastric tube. Always remember to fasten your tube and make sure that each time you are feeding, the tube is in position. The complications that we can get when the NG tube or orogastric tube moves away from position, one, the baby is likely to aspirate. And how do you tell that it has moved away from the position? You look at the mark that you put, but also as you are feeding the baby may vomit through the mouth and the nostril. Then you know that this tube is not in position. So such a tube needs to be replaced. Always remember that a nasogastric or orogastric tube can save life, but it can also take life if it is not in position. Thank you.